Much for joining me on a date with Ashley D. Today I have two beautiful women joining me by the name of CHARLENE FLOYD and also Debonaire Mills. We're going to be talking about BBLs. We're going to be talking about lymphatic massages and also personal training. We're going to discuss the risk factors and much more. So, ladies, are you ready?
Absolutely. Absolutely.
Okay.
Absolutely.
So first, I want to start off by talking about my own personal experience. I did have a BBL done. This was back in 2020, and so what motivated me to get a BBL was the fact that I had a C-section or whatever due to some complications, and so the doctor he didn't actually sew me back up the way I need to be sewn up. So therefore, my stomach, I had the little pouch, that you see in the pants and everything. So that brought about some insecurities within myself. I was very self conscious. And then also, growing up, I've always been told that I didn't have the biggest butt or whatever. So, of course, even though people saying, oh, she got a flat butt, you can say it jokingly, but mentally that messes with a person, on the inside because they're having to process this. And then when they look in the mirror, they're having to think about the things that you have actually said about them. So, everything
Yeah.
is, it takes a toll on you mentally and emotionally as well. And then when you're in the fitting room trying on clothes that you want to wear but you can't wear, it can cause different emotions to come on as well. And so I just wanted to share my experience with you all and just basically just keep it real about my journey. I did work out. I did diet, but nothing worked. So, CHARLENE, can you tell us a little bit about the stubborn fats that some of us have and also the different body types that actually harbor fat?
Absolutely. First, Ashley, I would like to say you look absolutely amazing.
Thank you. Thank you.
You look absolutely amazing. And you're absolutely right. That's one thing that I fully stand for is having the self-confidence in women all over the board. And it does not matter the shape nor the size. I'm in position to help women to build their bodies up and to build that confidence up. And I don't like bullies. I don't like bullies. I don't like those people that like to point out people's, shortcomings or things that are inferior to them. So let me just first stand on that wholeheartedly. I can contest with you on having that experience growing up with people making sly remarks and such. I've somewhat always been into fitness. However, we all gain body fat in different areas, and those body types do play a different part in your body type. You got the mesomorph, the endomorph, the ectomorph body type, and each one hold muscle mass differently, hold body fat differently. And so we do have those stubborn areas. And those women, such as when we have babies, and some women don't bounce back to that. Those C-sections, they cut different areas in your body. You may not have that muscle development there, or your body type. You may have the endomorph body type or the ectomorph body type, and those muscles are more harder to develop. So in targeting those areas, you're doing all the right things. I'm all for doing anything for a woman to help her to regain that area. The main thing that I want to always put on the table is to get into the gym. So you're starting to, now that you've had the procedure done, still give your body time to regain its full health return back. So the stubborn body fats, you're gonna make sure you're paying attention to the nutrition that you're putting in your body. Just staying away, cutting back on the sugars, the breads. You want to, after the procedure, you want to incorporate the proteins, and it don't have to be meat, because I know some of us are, tap into vegan, a vegetarian type. You still can get the proteins in. I'm gonna try not to go so deep with it. But you can get into that with the nutrition side of it. One of the big things that I like to, especially with women who are not really familiar with the gym and they want to get in there and do things on their own, my favorite that would target all those areas is the deadlift. I've always said this, if you take away all the exercises away from me, leave me the deadlift. That's going to target all the body. That's going to target the entire posterior chain. You're going to get the back, the booty, the calves, you're going to use your core muscles to get it. You're going to use your arms. You're going to use your triceps. It's a whole list of muscle groups there that is involved in that one exercise. So that's one of the things that you can do after having this procedure. And you're going to take your time. One of the main things is being patient with yourself. Be patient with yourself in return. Oftentimes it takes roughly, I think, about 3 to 6 months to fully get those fat cells back into, because they're going to lose some of them to get your body back into regimen. So get with someone who has a knowledge base in training that can help guide you and do a full assessment on understanding your body type, help you with your nutrition, help you with guiding into that. And it don't have to be a lifelong process. I would encourage anyone to, and it don't have to be me. It could be any great trainer that is willing to work with you on that. I stand and I promote women to do whatever it's gonna take to make yourselves have that self-confidence and to build your body up. So get with someone who has that knowledge base that can help you with your nutrition, help you understand your body type, help you understand your recovery and post-op as you journey ahead. You had the procedure in 2020, you look amazing, you're on the right track, and so many with a lot of other women that are going through the same thing. So targeting it, that's one of the main exercises that I fully put on the table to say, lift the weights, get off of the treadmill, pick up the weights, and it don't have to be heavy weights. It can be light weights. Start with the bar first, with just a standard Olympic bar. You don't have to put a 45-pound plate on there and start deadlifting with it. You can start with light weights, okay? And start in that area first. But get with someone that has the compassion, has the understanding, and is willing to work with you without having any misunderstanding about what your goals are. I hope that answers some of the questions there.
Oh yeah, you definitely answered my question, Charlene. And then also when you go through lipo, that weight can easily come back. So even if you are like eating healthy foods or if you're drinking a gallon of water a day, but of course your portion sizes may actually pick up because now you have those little hunger spells and you want to snack a little bit here and there. So how can you tell if you're trying to maintain? How can you tell if it's actually muscle weight or if it's just fat coming on?
Okay, great question. Again, so muscle is dense, period. Muscle is dense. So when you, again, understanding your body type, muscle is dense. 5 pounds is 5 pounds. 5 pounds of muscle is the solid fish. You got 5 pounds of fat, and it's going to be a larger, softer tissue. It's going to move more. So you're looking at controlling, once you have the, if you have liposuction done and you're noticing that you think that you're gaining the weight back, don't just go by the scale. So many people mess up just standing on the scale every day. Get off that scale. Get off the scale, start measuring your waistline, your hips, and your bust area. Pay attention to how your clothing are fitting you. And again, get with someone who can help you, even if it's for 4 to 6 weeks, just to get you on the right tracks and get you understanding what your body is doing. Understanding, because it takes about, for the average female, you're going to gain about 0.5 to 1.5 muscle mass in a month. And so you're looking at the high end of muscle. It don't take, we women sometimes think that as soon as we hit the gym, we pick up a 25-pound dumbbell, the first thing some women think is, I want to look like a man. Trust me, you're not. It takes time, repetitions to build that muscle mass up. So we're looking at 0.5 to 1.5 pounds of muscle a month on average. And that's really lifting at a really consistent pace, 3 to 5 times a week, targeting particular areas. Don't get discouraged. Stay off of the scale. Pay attention to how your clothing are fitting. Do measurements. Get your BMI, get your body fat checked. Understand where you are with that. And just feel on your body. You know, when you feel your stomach, if you feel like you say, I know I'm pinching an inch here, where last week I didn't have that much. And our hormones play a huge role in that. So don't get confused with that. We're women, we're hormonal, we have the estrogen levels in our bodies. So that sometimes monthly episodes in us on how we feel, make it a little bit more puffy. Stress hormone, your cortisol increases. It depends on your rest. It's so many different factors on that, and that's the reason why I really highly encourage, women to talk to someone on a level that has a little bit more comprehension of what your body is doing. But nonetheless, stay off of the scale, letting that be your only way you find out whether you're gaining or losing weight, because the scale can be tricky. 5 pounds is 5 pounds, and 5 pounds of muscle is dense. So sometimes you may step on the scale and you gain 5 pounds of muscle. You gain muscle.
Right.
But you think you're gaining fat. And if you only have a scale to go by and you don't know what your body is doing, you may easily get confused and think, oh my God, I'm gaining weight. And I've had women tell me this. They said, I'm going to the gym and I'm getting heavier.
Right.
Honey, get off of the scale. Don't step on that thing. It's a reason for it. It's good, but it's not the number one thing that you need to be going by to find out whether you're gaining or losing weight. Okay? So make sure you are checking your BMI, your fat, you're using a measuring your waistline, paying attention to how your clothing are fitting, and talking with someone who can help you understand what your body is doing and how your training is going about with what you're training for.
Okay, thank you, Charlene. So I'll be moving forward, I'll be cautious about stepping on the scale every day, and I'll just try to space it out a little bit, and also use the little measuring, what is the measuring tape that you measure around?
You're going to be measuring your waistline.
Okay.
And then, of course, if coming to me, I do a whole symmetry measurement with my clients. I'm measuring total body. I'm going to measure a whole symmetry. Usually, if you're doing it by yourself, you want to measure the bust line, waistline, and hips. I would even tell, to measure your thighs, because we women, we hold a lot of, we hippie, we got them hips, so we hold it in that area as well. So measure your thighs. And after that, just keep a good measurement and do that. And I wouldn't say you don't do that every week. You're going to do that maybe every 2 weeks, just to see how your body is going. 2 weeks, every 2 to 4 weeks is plenty enough for that as you are training. But making sure that you're staying consistent with your nutrition, and you're staying consistent with your training. Getting that training done. Absolutely.
All right. Thank you so much, Charlene. And I have a caller, Joe. I understand that you have a question for me as well. Is that right?
Yes.
Okay. Go ahead with your question, Joe.
My fault. You caught me off guard. How was the process after you experience, your, when you was getting your BBL, your surgery, or whatever? What was the experience like? How long did it take to heal? Tell me some things that people don't really know about going through that process.
Okay, I'd be more than happy to talk more about my process. And also, the date was actually April of 2021. Sorry about that, y'all. But okay, so it was very painful. It was a very painful experience. I was excited about it in the beginning, and as closer that it got to my date, I was very nervous. And so, of course, it's very expensive as well. You have to, everybody's finances are totally different. Me, I paid for mine bi-weekly, and I just had to, save, had to work overtime to make it happen. But everybody's financial status is totally different. Some people get credit, and they use credit for it. But I flew down there a couple of days before so that I could have fun in Miami. But, of course, you have to avoid smoke, so I was ducking and dodging everywhere I went. And then the morning up, I went for pre-op. You're going to go through the pre-op stage. You have to do your COVID testing and all that good stuff. You're going to sign a book. And to make it to that stage, you're pretty much going to, they've done all the blood work and everything to make sure you're healthy. It's very important that your iron level is up. If it's not, they're not going to perform that surgery. If anything comes up with your blood work, they're going to deny you for, different reasons. But don't get discouraged if they deny you, because this could possibly be saving your life as well. But I got through everything. On the morning of my surgery, he drew me up, drew on my body and everything. He told me I was going to have a natural look. I did want a vixen look, but he told me that wouldn't be beneficial for me with, my legs. He wanted everything to match. So I was like, okay, I trusted the doctor. He told me he was going to treat me like I was his child, and that made me feel better. That relieved some of the anxiety. The morning of, went in there, laid on the table after the anesthesiologist came in, and so they were talking to me. And next thing I know, I was waking up. I was in pain. I did not feel like myself. I was asking myself, why did I do this? It was not worth it. Never experienced death, but I'm like, oh, I feel like I'm dying. It just did not feel right. I didn't feel like myself. Um, when I got into the van from the recovery house, they sent a van out. So I got in the van. I remember calling my mom, and so the people were telling her that I was okay. I told her that I was okay, but I was in pain. And you do have to plan for a recovery house as well. That's another expense. And so I went to the recovery house. Again, I was crying, asking myself, was it even worth it? A lot of times you see the bodies, but you don't understand the experience. I was bleeding out everywhere because with a BBL, they're going to insert a cannula, and those marks where they do the insertion, those pores are going to be open, so you're bleeding out. So whenever you're drinking your fluids, blood is coming out everywhere. I was laying on the bed on my stomach or whatever. You're going to have a nurse at the recovery houses. Every recovery house is going to give you a different experience. Your blood pressure is going to have to be checked. There's going to be times you're going to get lightheaded. I got lightheaded a couple of times, and they gave me some alcohol swabs to keep with me whenever I had that experience, because when I went to the restroom, I wanted to be more hands-on with my own self. I didn't want anybody in there with me. You know, I'm personal like that. So just they'll feed you your meals, make sure you get your medicine, and then of course while you're there you can get lymphatic massages as well. Now the swelling, oh my god, you're gonna be swole, you're gonna be hurting, but the lymphatic massages, they do help release some of that pain, and so you have to prepare for that as well. So Shani, can you tell us a little bit about lymphatic massages and how they can actually be beneficial to you right after surgery?
Sure. So, guys, so lymphatic massages deal with the lymph nodes in your body. We have over 128 nodes that are located from head to toe. These components literally help your body drain toxins, fluids, and things of that nature that are actually locked in our bodies. Once you have surgery, your body goes in this phase. I'm going to make this as simple as possible. So, fat was extracted, right? So when you take something out of your body, it has to replace itself with something. And usually that's going to become fluid. And what happens is people like myself, practitioners, massage therapists, doctors that are trained in these areas, we know how to manipulate the fluid where it literally leaves your body in the most effective and safe way. Because if you continue to swell up and swell up and swell up, it's not only going to be painful, but it's also going to possibly have something perform itself and grow called fibrosis and seroma. And those are a nightmare. I'm not gonna lie to you, they're painful, they hurt, they're full of blood and fluid that now at this point has to be drained by needles, and you just don't want that experience. So I recommend to everyone, all of my clients, all of my patients, lymphatic massages are a must. They are the difference between having a effective recovery that is going to still consist of pain, but you're going to have some type of alleviating process. Or if you don't get them, you just kind of have to worry about that pain, the swelling, and rely on compressing highly.
Okay, and while I was at the recovery house, I had gotten a massage there, and the girl took like the end of a Q-tip, and she opened up one of my, I guess, incisions or whatever, and she like pushed the fluid out. So, have you ever done that to one of your clients where you had to reopen like one of the incisions and push fluid out, or was that safe?
Ooh, okay, no, I've never personally done it, but I do not speak against individuals that do. I can only explain to you and my practices, the physicians that assist and work with me and all of my employees. Mm-hmm. There are three reasons we do not reopen incisions. Okay. One, if you do not have any like liability insurance or things of that nature, you want to shy away from it, because at that point you're going behind another person's work. You did not do that surgery. You did not make those incisions. That is not your work. So if anything happens, okay, let me just use you as an example, Ashley. Okay. So say you're fresh out of surgery, right? You come to us and we know like, ooh, like this can alleviate. If we open this incision, this can get the fluid out quicker. She's gonna feel better instantly, and it's gonna make our jobs easier. However, Say we don't know you have an infection under your skin because you heal from the inside out 1st, and we reopen that incision, and it causes you to have blisters. It causes you to have an infection that turns into mucus and green and things of that nature. Who do you think gave you that infection? Just based off of what you're going through at that moment.
The massage therapist.
Exactly, and we did. Right, we literally, it was already in your system. It was already growing underneath your skin. You can't see what's going on inside of you. However, that is the number one reason that I strongly recommend individuals to not reopen incisions. It is not your work. Do not take the liability. It's just not worth it. One of my mentors, she's a really, really amazing mogul in this industry in Miami. It was very controversial probably about 6 or 7 months ago because of the very same topic that we're talking about today. Guess what happened to her?
What?
They stripped the license. So there was years and decades that this individual had been building her platform. Probably one of the best individuals in our industry. Not only because of what she does, and she has a huge following, and she has over 200 employees across the southern region. It's because of the fact that, guess what? It was something that's unethical. It's something that if you're not a medical doctor and that was your surgery, that you should not be following up behind. It's something if you're not a medical doctor that has the right and the licensure and the knowledge to how to make someone feel better or the correct meds to prescribe. If they identify what's going on there, that's not in your scope, don't touch it. So no, I have personally not. And I would never. And I think I tell everybody all the time, I'm licensed to do it. I'm just not going to do it. There's so many other ways that I can make sure your recovery is the most effective and efficient, and reopening your incisions is not one.
Got it. Okay. And also with the massages, can you tell us like the benefits as far as like, does it speed up your metabolism or how does it help in those aspects?
Okay, so massages are beneficial from many scopes, okay? Mentally, it is soothing because once individuals like yourself, you come out of surgery, you guys your adrenaline is rushing and pumping because this is an invasive process. It hurts. Like you just literally took your body through trauma, right? So the massages are comforting, right? However, those areas of your body, they're tender. They're tender to the touch. You don't want nobody to touch you. It's painful. However, I tell people if you can get through the first 5 minutes, the first 5, you're gonna thank us when you get off the bed. So it also provides you instant relief because your body is so built up with fluid. Even if you're compressing is the number one most important thing outside of hydration. Just like Miss Floyd was saying, just knowing your body, your hydration, your fluid levels, eating right, all of that wonderful stuff. All of that stuff is a part of this mechanism. And I agree with everything Ms. Floyd said earlier. Surgery doesn't start the day of getting on that surgery table. I think when my clients come in for pre-op, I send them through a very rigorous application process, and not an application process like, oh, you're trying to fill out for something. It's to first see if you're a candidate for surgery, because a lot of times we don't realize in our culture that we have so many underlying health issues. We don't realize we have high blood pressure. We don't realize we have vitamin deficiency. We don't realize that our eating habits are not only unhealthy, but it needs some work there. So I love that individuals are getting cosmetic surgery because I am all about confidence, doing what makes you happy, but I want us to be safe in the process. So massages, I know there's a lot of controversial information out there about lymphatic massages, but I will tell you this. If you understand the anatomy of your body, just imagine somebody putting an instrument in it, sucking out fat, putting your body through an invasive procedure for about an hour, hour and a half. If you honestly believe that you could get through that procedure with not any aftercare that is soothing, that knows how to direct those fluids out of your body efficient, then you need to really go back to researching.
Okay. Thank you so much, Shawnee, for your expertise on the lymphatic massages and metabolism and everything. If there's any technical difficulties with the Zoom, just call back in, okay?
Okay, gotcha.
All righty. And also, Shawnee, people get impatient with their body and everything. Whenever they're doing like on the massage process, when they're first out of surgery, they want their body to look a certain way. So how long does it take for you to like sculpt their bodies? Like how many massages do they have to have?
Okay, so actually, technically, that's a tricky question because everybody's body is unique and is different. Some people can jump out the bed and be like, "Boop, okay, sis, amazing." It,
Mm-hmm.
but some people can jump out the bed and they feel that their body is worse than it was before they got on the bed. Others can jump out the bed and they go into it and they have no pain and they look at themselves and they're perfectly okay with where they are. I always tell people the magic number in your head should be anywhere from 15 or more. I know a lot of research says 10, but I'm gonna tell you why I think the number 10 is one of those numbers that, oh, I got the 10, I'm gonna stop. It is not that. Okay. So the first day you got the surgery, your body is in a panic mode. So it's like being a new kid on the playground, right?
Mm-hmm.
You're out of place and you're trying to figure out where you belong. So you're just all over the place. That's the same way your body is responding and the fluid is. So you're gonna need massages daily for a week. How many days are in a week? 7. Okay, great. So there's 7 at the top, right? So 7 and 10 is 3. There's 3 left. There is no way possible you can believe that you only need 3 more massages on a procedure that you literally just probably have at least up to 4 liters of fat removed. Okay. So the next week, we recommend you having massages at least 4 times a week. So that's 11 right there. Now that means that's if you're still drinking at least 100 ounces of water, which kind of is equivalent to a gallon. That means if you're compressing 23 hours a day, 7 days a week, the only time you're coming out of your fajas are to use the restroom and to shower, right?
Right.
It also means that you're feeding the fat. And this statement has gotten so many people like to the point where they think feeding the fat is like gorge, 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 gorge. No, it's not. It's healthy fats. It's omega fats. So that is stuff like, pistachio nuts, avocado, eggplant, like things of that nature. But if you didn't go see people like Miss Floyd in the beginning to go ahead and tell you and give you strong advice about what are healthy fats, and eating healthy isn't boring. You just need to know what to eat and how to season it and how to make it colorful and fun. The same thing that you had to do to your body before to get in line with surgery is the same thing you have to do after surgery, and the same thing you have to do to maintain the maintenance of your body. So that's why I say massages are necessary, as they are expensive. I'm not going to sit here and fabricate. They are very expensive, especially because you have to get so many of them. Then there are so many supplies and materials you need after surgery. I tell people call.
So we went over the massages. We went over the fact that massages can be expensive. They're definitely necessary. The diet plans that you take before the surgery, you're gonna also have to keep up those meal plans after the surgery as well because you want to keep your body healthy after they sucked all the bad stuff out of your body. And then also you want to, like she mentioned, blood pressure. You know, we have so many underlying health conditions to where you need a healthy body before you even think about going into cosmetic surgery. And then also after you go through cosmetic surgery, just continue to take care of your body because your body is your temple. Take the necessary supplements that have been, prescribed to you by your doctor, whereas, different vitamins. Personally, I took like the beetroot pills, and then also I drank the beetroot juice as well. It was very beneficial for my iron. And then also I took the turmeric vitamins. I took those, and also I did take calcium as well. I drank a lot of pineapple juice before and after my surgery because pineapple juice is going to help with the healing. It's going to help with your healing process. I drank, and still to this day, I drank a gallon of water a day. It helps keep you flush. And even though it's been like a little over a year since my surgery, I still compress. I still wear my garment so that to me, it just keeps down the swelling, and also it keeps your shape or whatever. And that's pretty much about it. Joe, did you have any additional questions for me?
Um, no, man. I think that's it. It might hit me later. I might be mad about it later. Um, no, not right now. Not at the moment.
Not right now? Okay, no problem. So I'll finish telling you all about my experience. So my surgery date was on a Friday, and then after my surgery date, everything was fine at the recovery house. But personally, I just felt like some of the things that was being done, I could have did myself at home or I could have been, my kids could have been helping me out, because there's only so many nurses at the recovery houses, and then you have so many patients as well, and all of the patients are there for like different reasons. So it may be time for you to take your medicine, but then you have a roommate that may need some assistance with something totally different. So therefore, you may have to wait a while, and it may take longer than 30 minutes for them to help someone else. So therefore, you're going to need, I suggest, a one-on-one nurse there with you at all times, because they're going to be hands-on with you more so than the nurse who has other patients to actually attend to. But I flew back home on a Monday. At the airport, when I went to the restroom, I did get a little lightheaded, but I took some alcohol swabs with me, and I had them in my bag, so I was able to actually sniff the alcohol, and that helped me to keep from fainting at the airport. And so I was all alone. I was by myself. I did have wheelchair assistance, so they were able to wheel me through the airport and everything. On the plane, it was very uncomfortable. It was a lot of turbulence, so therefore they didn't allow us to sit on the floor with our knees and face the seat. I couldn't do that, so I had my BBL pillow. I had to sit on the BBL pillow. Again, it was very uncomfortable because I didn't want to mess up my results, and the only thing that was going through my mind is, why didn't I stay a little bit longer? I should have stayed longer, because now I'm running the risk of something going wrong. But my kids, they came to the airport to actually pick me up, and so I was asked, how did my kids feel about me having surgery? Well, personally, my kids, they were excited about it, but once they saw the pain that I was in, they say they would never do that to their bodies, and they don't want me to go through that again. So therefore, even though I want more work done, because there's some things that I see need a little bit more work, I decided for my kids' sake not to do that, not to put them through that again. And so after that, that's basically it. And so made it home. My kids had to take care of me. I had a bell that I had to ring for them to come and help me to the bathroom. And so after them helping me to the restroom or whatever, they gave me my privacy, of course. Then they had to help me back in bed, had to sleep on my stomach. My back was hurting very bad. It's just a lot of things that come into place when you're having cosmetic surgery. You don't see the pain that people actually go through, but it's the pain that I would not wish on anyone at all.
I got a question.
Okay, go ahead.
So let's just say you out here in this dating world after your surgery or whatever. Do you be that open enough to tell a dude, or you just let him think whatever he think, about the way he look at you? Do you or just be open and honest, like, look, I done had this done, or you just let him think what he think? It look real. I'm gonna let him, feel real, whatever, Do you just let him go off his thoughts, or?
Well, in the beginning, I let them go off their thoughts. I have to feel them out, see what's going to be what first. And so as the conversation, or if we proceed to go any further, dates or whatever, and they ask, then yes, I am open and honest about, yes, I have had a procedure done. Yes.
What will be most of the reactions from the dudes you have told about it? Like, do they be more happy, or they be like, man, it's cool, or like they don't really care about it? Like, what was their reactions when you told them?
Well, guys, they're like, oh, well, that looks good. And, they'll tell you that your surgery looks good and everything. They like the results. And then you have some that as soon as they're mad with you, they'll be like, oh, well, your body is fake. Well, it's actually a fat transfer where they took fat from one area to another area. So it's not fake. It's real. It's just resculptured. That's pretty much all it is. And before telling a woman, well, that's why your body is fake, get to know her and ask her, well, what was the reason why you had your surgery? What brought about your insecurities? Because everything is not social media. Some things are more personal, like, such as C-sections, or having stubborn fats to where they can't get rid of it in a gym. It can just be a number of things, or people have picked on them all their lives. It can be a lot of different things that will trigger a person to want to make some body adjustments. But in my eyes, a body enhancement is no different from a woman weaving her hair, getting her nails done, getting her toes done, eyelashes. We like to dress up. So we put on things to make ourselves look and feel good. So making a body change is just something, different. Did you have any other questions for me, Jeff?
No, I think that's about it. I think that's
from a male perspective, that's good. Come on with another question for me.
Let me think. Hold on, because I sometimes I was thinking of it and I forgot. I'm going like really listening to you and tuning what you got. How you telling your story.
But someone has asked me before about kids and my kids, and why would you do this? What kind of example are you setting for your girls? Well, I'm very transparent with my girls. I'm open and honest with them about a lot of things. They know why I made my decision. They respect my decision, and of course, I always talk to them about self-esteem. I always encourage them as well to feel good about their bodies. I'm constantly telling them how beautiful they are. I compliment them on their shapes, their natural body, their natural beauty. And so, and even with my experience alone, it just has shown them, you do not have to, don't put yourself through this type of pain. That was just mommy's decision, but that doesn't mean that you have to walk the same road that your mom walked. So that's basically it. But it's been a journey. And of course, I've always been cautious about who I allow into my world. But now that I've had the procedure, I'm even more cautious, because now you're going to have to tell me why you're wanting to get attached to me. Because is it this physical appearance that you're seeing, or do you really want to get to know Ashley? So, Joe, you were asking me earlier about that. So can you re-ask that question for me?
Yeah. Is it hard to figure out like what dudes really want from you? Like I know some of them may be honest, but for the ones who might lie and you figure out in the long run, like how that make you feel? Do they just blatantly say, like, "I'm sorry"? Like how that go about? Like for the dudes who really pretend for so long, or if they may not pretend, they really might just like you as a genuine person. You know what I'm saying? They don't care about that. Like tell me that type of experience, or you tell me the difference between them from a dude who really what I'm saying, want you for you versus just want you for your appearance.
Well, first and foremost, I'm like, you have to tell me what it is about me that you like, what is attracting you to me. You have some guys that are very open and honest and that'll say they want to sleep with you. And then you have some guys that really want to get to know you and that are attracted to your body. However, they still want to build with you and still want to have something with you, because just like us women, we're attracted to men because of this, that, and the third. They're going to have their attractions as well, and they like what they like. So regardless of how you got it, that's still what they want. So therefore, they're going to do whatever it takes to, come in your world and, enjoy you and, your new body or whatever. But, and then you have some that they'll date you for a while just to say, hey, I'm dating her. I've been with her or whatever. But in that aspect, I mean, it's just kind of like a hit or miss. Some relationships work out, some don't. But you just have to be careful with who you allow into your world and what men you are attracting. But most of the times, a man, he can tell what type of woman he's stepping to. They know, okay, she's out of my league. And same thing with a woman, no, he's out of my league. I'm going to stay over here in my lane. They know what lane to actually travel in. So therefore, whatever type of woman you are, pretty much those are the type of dudes you're going to pretty much attract. And because the ones that are not in your lane, they may look, but they're going to be slow to approach because you carry yourself at a certain standard. Did that answer your question, Joe?
Yes, it did. I think that's it. I don't know. I have another one. I'm still thinking.
Well, thank you, Joe. But I'm trying to think of just some other things as far as just like cosmetic experience. Oh yes, doctors. Do your research when it comes to these doctors, because some of these doctors, they'll give you your results, but they're taking out too much fat, which is going to run risk of you dying on the table, or you can have some underlying health conditions, but they're looking at the dollar, so they're willing to put you on this table and put your life at risk. Because they're looking at the money part of it, and they're going to go ahead and do this surgery, but knowing it's not safe. So just read your reviews, do your research, do your own research. Do not go off what anyone else says. I did my own research on these doctors, and I tell you, I looked at a lot of doctors for about maybe a year or two before I even, just made my final decision on a doctor. So definitely do your own research. Make sure you're healthy. It's a lifestyle change. So change your lifestyle before you lay on the table, such as your eating habits, your vitamins, your water intake, your exercising, even if it's just 30 minutes a day. Just go about it. Just change everything beforehand, because that way it'll help you along the way after your surgery, because this is an investment and you have to protect your body, the body that you have actually invested in, because it's not cheap at all. It's going to cost you before you have this surgery, and it's going to cost after you have the surgery as well, because the aftercare is expensive. Whereas it's getting fruit. Fruit is very expensive. Anything healthy is expensive at the grocery stores. You're going to have to pay for your healthy eating. Even when you're eating out, just choose healthy things that are actually on the menu. And that's basically it. And it's a scary experience when you're going through it. But, of course, at the end, you're going to love your results. People say, people don't tell you the good, bad, and the ugly, and why she putting herself through this. just always get to know the person's underlying reason first before passing judgment, and just know that some people don't have the willpower to just go hard and exercise, and you have some that do. Me, on the other hand, I have died and exercised all my life and still didn't get the results that I wanted, so I made a decision. And also criticism, so just think about that when tearing people down as well. Just try to uplift people and encourage them versus attacking the decisions that they make for their lives. But I do want to thank you all so much for joining me on A Date with Ashley D. I hope this helped. If it did not, message me, send me some questions, inbox me. I'll be more than happy to answer your questions. You can reach me on Facebook, Ashley D Speaks, YouTube, Ashley D Speaks, and also Instagram, Ashley Davis _speaks. Have a great day, you guys.